Have you ever felt a little more out of breath than usual after a simple walk around the block? Or perhaps you've noticed that your legs seem to feel heavier. Or maybe you've had moments where your chest felt tight, even though you were just sitting quietly. It's easy to brush these things off, thinking they're just a part of getting older. But the truth is, there are subtle signs your body might be sending you, especially as we age, that shouldn't be ignored. And one of the most important signs to pay attention to? Cardiovascular health. You see, cardiovascular disease doesn't always announce itself with dramatic symptoms. In fact, many signs can be quite subtle, especially in the early stages. And by the time the more obvious symptoms appear, your heart may have been struggling for a while. That's why it's so important to recognize the early warning signs, so you can take action before things get worse. In this video, we're going to talk about 5 common but often overlooked signs that could indicate you're at risk of developing cardiovascular disease. These signs are not always obvious, and they may not cause any serious alarm right away. But when you start noticing them, it's worth paying closer attention, and if necessary, getting checked by a healthcare professional. It's all about being proactive and taking control of your health. Let's start with the first sign: fatigue. Now you might be thinking, well, I get tired. Who doesn't? And you're absolutely right. Fatigue is a normal part of life. But when that fatigue feels different, when it's more overwhelming than usual, or it comes on with activities that you used to handle just fine, this could be a warning. If you find yourself feeling unusually exhausted after simple tasks, like getting dressed, walking around the house, or even having a conversation, it could be linked to your heart. Fatigue is one of the most common symptoms of cardiovascular disease, and it often happens because your heart isn't pumping blood as efficiently as it should be. When the heart struggles to circulate blood, your body doesn't get enough oxygen, which can make you feel drained. So while it's normal to feel tired after a long day, if you're noticing that you're constantly fatigued, even after resting, it might be a good idea to talk to your doctor. Now let's move on to the second sign: shortness of breath. This one can be tricky because it can happen for all kinds of reasons. Maybe you've just climbed a flight of stairs and find yourself a bit winded. Or perhaps you've been walking for longer than usual and feel like you're struggling to catch your breath. While shortness of breath can be normal with physical exertion, if it starts happening more often, or at times when you're not doing anything particularly strenuous, it's something to pay attention to. When your heart isn't functioning properly, it can't pump blood efficiently to your lungs and other vital organs. This can lead to fluid buildup in the lungs, which results in difficulty breathing. For many people, this is one of the earliest signs of heart failure or other cardiovascular issues. And even if you've never had any heart problems before, if you start noticing that shortness of breath becomes more frequent or occurs during activities that didn't bother you in the past, it might be time to take a closer look at your heart health. As you can see, these early signs, fatigue and shortness of breath, are easy to dismiss. After all, who hasn't been a little tired or winded from time to time? But when they start becoming more frequent or affecting your daily life, they could be trying to tell you something important about your heart. Now that we've covered fatigue and shortness of breath, let's talk about another sign that's often overlooked: swelling in the legs, ankles, or feet. This one can be a bit tricky because some amount of swelling can happen from time to time, especially if you've been on your feet for a while or have had a salty meal. But if you notice persistent swelling, or it happens even when you've been resting, it might be a red flag for heart-related issues. When your heart isn't pumping blood effectively, fluid can build up in your lower extremities. This happens because your heart isn't able to keep up with the demand for blood flow, causing fluid to pool in the legs, ankles, and feet. If you find that your shoes are getting tighter, or you have to keep your feet elevated more often, it's worth considering whether your heart is playing a role in the swelling. Swelling like this can sometimes be a sign of heart failure, especially when it's accompanied by other symptoms, like fatigue or shortness of breath. And while it might seem harmless at first, persistent swelling should never be ignored. If you're seeing these signs, it's a good idea to consult with your doctor for a proper assessment. Now that we've covered these 3 warning signs, fatigue, shortness of breath, and swelling, let's move on to the next part of our conversation. There are a couple more subtle symptoms to watch out for, and they may surprise you. So stick with me as we dive deeper into what your body might be trying to tell you. Part 2. Continuing with the signs. Now that we've covered fatigue, shortness of breath, and swelling, let's talk about the 4th sign that often goes unnoticed: chest discomfort or pain. You might have experienced it at some point. A little tightness or pressure in your chest after a long day, or even when you're resting. The thing is, chest discomfort can be tricky because it's not always the sharp, crushing pain that you see portrayed in movies. It can feel more like a mild pressure or a subtle ache that comes and goes, and that's why many people don't think much of it. However, even mild chest discomfort should not be taken lightly, especially if it occurs frequently or feels different from what you're used to. This could be a sign that your heart is not getting enough oxygen, which is a key symptom of coronary artery disease or even an impending heart attack. The discomfort might also radiate to other areas, like your arms, neck, back, or jaw, but sometimes it just lingers in the chest area. It's important to note that this doesn't always happen during heavy physical exertion. For some, it can occur after simple activities or even while resting. If you feel tightness in your chest that doesn't go away after resting, or if you notice it happening more frequently, it's best to have it checked by a doctor. In many cases, it could be a signal that your heart's health needs attention before things escalate into something more serious. Moving on to the 5th and final sign: irregular heartbeat. Have you ever felt your heart racing for no obvious reason? Or maybe you've noticed it beating erratically, skipping a beat now and then? It can be a little unsettling, right? An irregular heartbeat, also known as arrhythmia, can take on many forms. You might feel palpitations or a fluttering sensation in your chest. While some irregular heartbeats are harmless and happen occasionally due to stress or excitement, others can be a warning of a more serious problem, like atrial fibrillation or heart failure. Arrhythmias can cause your heart to pump inefficiently, affecting blood flow to the rest of your body. This can lead to symptoms like dizziness, fainting, or feeling lightheaded. If you experience these sensations frequently, or if they're accompanied by other signs like shortness of breath or chest discomfort, it's important to speak with a healthcare provider. Left unchecked, arrhythmias can increase the risk of stroke or other complications. Fortunately, they can often be managed with medication or treatments like pacemakers, but you'll need to get checked to know what's really going on. It's worth mentioning that heart palpitations are quite common as we age, but it's always best to have them evaluated to rule out any underlying issues. Your heart health deserves your full attention, especially when these types of changes occur regularly or seem to worsen over time. Now, as we wrap up these 5 signs: fatigue, shortness of breath, swelling, chest discomfort, and irregular heartbeat, I want to share a crucial message with you. These signs may seem subtle and easy to dismiss, but they are important signals from your body. The earlier you recognize them, the sooner you can take action to protect your heart and overall health. Remember, it's always better to be cautious and get checked out by a doctor rather than wait for more serious symptoms to appear. If you're unsure about any of these signs, don't hesitate to reach out to your healthcare provider. We've gone through a lot of information, and I hope you now feel more confident in recognizing the early warning signs of cardiovascular disease. But it doesn't stop here. In addition to recognizing these signs, there are things you can do to improve your heart health and reduce the risk of cardiovascular issues. In the next part of this series, I'll share some practical steps you can take to protect your heart and improve your overall wellness. Taking charge of your heart health is one of the best decisions you can make at any age. And trust me, you're never too old to start making positive changes that can enhance your life and longevity. So let's keep going and explore what you can do to support a healthy heart and feel your best every day. Part 3. Practical steps for a healthy heart. Now that we've discussed the 5 subtle signs that could indicate cardiovascular disease, fatigue, shortness of breath, swelling, chest discomfort, and irregular heartbeat, let's talk about what you can do to protect your heart and improve your overall health. The good news is that there are simple, actionable steps you can take to help maintain or even improve your heart health as you age. Let's dive into some practical tips that can make a real difference. First, let's talk about regular exercise. You don't have to run marathons or hit the gym every day to reap the benefits. In fact, some of the most effective exercises for your heart are the ones that are gentle but consistent. Walking, swimming, biking, and even gentle yoga can improve circulation, lower blood pressure, and strengthen your heart. Aim for at least 30 minutes of moderate exercise, 5 times a week. It doesn't have to be all at once either. Small bursts of activity throughout the day can be just as beneficial. The key here is consistency. It's about creating a routine that works for you. Start with something manageable, like a 10-minute walk after lunch, and gradually increase the time or intensity as you feel comfortable. And remember, the goal is to keep moving. Sitting for long periods of time is a risk factor for heart disease, so try to find ways to incorporate movement into your daily routine. Even simple things, like standing up and stretching every hour or parking farther from the store entrance, can add up. Next up is eating a heart-healthy diet. A well-balanced diet is one of the most important ways to reduce your risk of cardiovascular disease. Focus on eating plenty of fruits and vegetables, whole grains, lean proteins like fish and poultry, and healthy fats, such as those found in nuts, seeds, and olive oil. Foods rich in omega-3 fatty acids, like salmon, walnuts, and flax seeds, can help lower bad cholesterol and reduce inflammation in your body. Also, try to limit foods that are high in saturated fats, trans fats, and sodium, as these can contribute to high blood pressure and unhealthy cholesterol levels. Opt for whole, minimally processed foods whenever possible. And remember, you don't have to make drastic changes overnight. Start by adding 1 or 2 servings of vegetables to your meals, or swapping out a sugary snack for a handful of almonds. Small changes can lead to big improvements in the long run. Along with a healthy diet, managing your weight is crucial. Maintaining a healthy weight can help lower your risk of heart disease, especially if you carry excess weight around your middle. If you've gained weight over the years, you don't have to aim for drastic weight loss. Losing just 5 to 10% of your body weight can make a significant difference in your heart health. This can improve your cholesterol levels, lower blood pressure, and reduce your risk of diabetes, all of which are important for protecting your heart. One way to help manage your weight is by staying mindful of portion sizes. Even when eating healthy foods, consuming too much can lead to weight gain. Try using smaller plates or paying attention to hunger cues to avoid overeating. Additionally, Drink plenty of water throughout the day to stay hydrated and support your metabolism. Another key factor in protecting your heart is managing stress. Chronic stress can contribute to high blood pressure, inflammation, and poor heart health. While it's impossible to avoid all stress, there are effective ways to manage it. Simple relaxation techniques, such as deep breathing exercises, meditation, or even listening to calming music, can help lower stress levels. Engaging in hobbies you enjoy, such as reading, gardening, or painting, can also serve as an effective stress reliever. If you find that stress is overwhelming, consider talking to a therapist or counselor. Talking about your feelings and learning coping mechanisms can make a world of difference in your overall emotional well-being and your heart health. Now let's talk about getting regular checkups. This might sound obvious, but it's crucial to see your healthcare provider regularly, even if you're feeling fine. During these visits, your doctor can check your blood pressure, cholesterol levels, and other vital signs, helping to catch any early signs of heart disease. If you notice any of the subtle symptoms we discussed earlier, be sure to bring them up with your doctor. Early detection is key, and your healthcare provider can help you develop a plan for monitoring your heart health and preventing any potential issues from escalating. In addition to regular checkups, be mindful of medications that may be affecting your heart. If you take medications for high blood pressure, cholesterol, or other heart-related conditions, it's important to follow your doctor's instructions closely. Don't stop or change any medications without consulting your healthcare provider first. And if you experience any side effects from your medications, let your doctor know right away. Finally, don't forget about the importance of social connections and emotional well-being. Maintaining strong relationships with family and friends is not only good for your mental health, but it can also benefit your heart. Research shows that people with strong social support are less likely to develop heart disease, and they tend to live longer, healthier lives. Stay connected with loved ones, and consider joining a community group or activity that interests you. Whether it's a book club, walking group, or volunteer organization, being socially active can reduce stress, boost your mood, and improve your overall quality of life. As we wrap up, I want to emphasize that it's never too late to take control of your heart health. Small, consistent changes can add up over time and have a big impact on how you feel and how long you live. Listen to your body, pay attention to the warning signs, and take proactive steps to protect your heart. Remember, you're not alone on this journey. There's a whole community of people out there who are also working toward healthier, happier lives. By taking action today, you're investing in your future health and well-being. And don't forget, every positive choice you make, no matter how small, is a step toward living your best life at any age. Keep moving, keep eating well, keep managing stress, and above all, keep believing in your ability to live a long, healthy, and fulfilling life. Thanks for watching, and if you found this video helpful, be sure to like, share, and subscribe for more tips on living a healthier, happier life at any age. Here's to a heart-healthy future.